If you have failed kidneys, you might want to know about this. Humble Vascular Surgical Center is the only outpatient surgical center in Greater Houston to offer 2 new technologies for life-sustaining dialysis treatment. I spoke with Dr. Ruchdi Barakat about how these treatments are becoming the new standard of care. Dr. Barakat, one thing I find with a lot of people is that they have seen their parents go through things or relatives go through things decades ago, and they forget that things have changed over the years. Modern technology has made things a lot easier and a lot more effective.
The technology had improved significantly over the 50 years in the realm of what we do. I'm going to talk a little bit about arteriovenous fistulas. And an arteriovenous fistula, just to give a little bit definition and some historical background about what we're talking about for our viewers to understand more. A AV fistula is a connection between an artery and a vein that is usually created surgically. The first AV fistula was created in 1966, about 23 years after the first hemodialysis treatment was done. Now,
so this is a person who would use something like this, is somebody who's going through dialysis?
Correct. Somebody whose kidneys failed and requires hemodialysis or renal replacement therapy. They need an AV fistula or an AV graft created to remove the blood out of their body to a machine to wash it and to send it back to their body. So in 1943, the first treatment was done by an Austrian physician, Dr. Kolff. And in 1966, 2 American vascular surgeons created the first surgical AV fistula. Since 1966 until current time, technology had not improved significantly until 2018 when the Food and Drug Administration approved 2 modalities to create AV fistulas non-surgically using percutaneous approach or interventional approach.
So when you do something that's minimally invasive, that's got to be much better for the patient.
That is correct. The patients do not require general anesthesia. There's no surgical scar. The risk of bleeding and vascular damage and infection is much, much lower. And it's a very short procedure that is done completely in an outpatient setting.
All right. Tell us about the ellipsis, which is one of those things that you're talking about.
So ellipsis is one of the 2 modalities. Ellipsis uses a 6 French sheath where you can access a perforator vein, and that through that vein under ultrasound guidance, you go into the radial artery. Once you have established a connection between the 2, a special catheter goes in and it releases heat for 10 seconds, and that fuses the artery to a vein, and that creates an arteriovenous fistula. The procedure takes about 10 to 30 minutes. Patients are almost awake during the whole procedure. They're consciously sedated, so they're comfortable, there's no pain, and fairly quick.
All right, and then there's the wavelength.
So wavelength is the other modality. This one uses radiofrequency ablation. So a catheter is introduced in a vein, the other catheter is introduced in an artery, and they have a magnet. So the 2 catheters under fluoroscopic guidance, they get aligned, the magnets engage, and 0.7 seconds of radiofrequency power is introduced, and it creates a connection between the artery and the vein.
All right. Technology is only as good as the people using it. At Humble Vascular Surgical Center, you pride yourselves on having people with the top expertise. And not only that, how you make people feel when they come in, you treat them like family, because this is a scary time for a lot of folks.
You're absolutely right, Deborah. Patients do not want to be in the hospital. We do all our procedures in a completely outpatient setting. We've been doing this since 2012, and we have done over 24,000 procedures in the Humble area. And we are proudly the only dedicated ambulatory surgical center that is performing these 2 specific procedures. On top of that, we do limb salvage therapy, we do varicose vein treatment, and we do a whole array of hemodialysis access care.
Yeah, and I would imagine this is in much more demand, in part because we see the rise in diabetes, for example, and that is one of those things that can lead to the need that you all can fulfill.
You're absolutely, again, correct. Unfortunately, Houston is one of the leading cities in the country in terms of end-stage renal disease and failed kidneys after Atlanta. And it's due to the high rates of diabetes, as you mentioned, and high untreated high blood pressure.
That's one of those places where we don't want to be number one or number two, but the good news is that we have someone who's number one who can help people manage this. Dr. Barakat, thank you very much.
Thank you very much for having me.
Humble Vascular Surgical Center has a special offer for Great Day viewers. Throughout November, you can get free leg screenings for varicose veins, venous insufficiency, or peripheral arterial disease when you mention Great Day Houston. Give them a call at this number. It is 346-616-5862. That's 346-616-5862. Or visit them online at humblevascularsurgicalcenter.com.